Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Acute epididymitis is a condition that affects men. It is an inflammation of the epididymis. The epididymis is a tube located at the back of the testicle. This tube is responsible for carrying and storing sperm. When this tube gets inflamed, it can cause pain and discomfort. Acute epididymitis is often caused by bacteria. These bacteria can come from the urethra or the bladder. The urethra is the tube that carries urine out of the body. The bladder is where urine is stored. This condition can affect men of all ages. However, it is most common in men between the ages of 14 and 35. This is because men in this age group are more likely to be sexually active. If you think you might have acute epididymitis, it is important to see a doctor right away. Early treatment can help prevent complications. The most common cause of acute epididymitis is a bacterial infection. This can be caused by sexually transmitted infections, like chlamydia and gonorrhea. These infections can spread through unprotected sex. Sometimes, bacteria that normally live in the gut can also cause acute epididymitis. This can happen if the bacteria get into the urinary tract. This can occur during anal sex or if you don't wipe properly after a bowel movement. Other causes of acute epididymitis include urinary tract infections, prostate infections, injuries to the groin, and medical procedures such as catheterization. It is important to practice safe sex and good hygiene to reduce your risk of developing acute epididymitis. Acute epididymitis typically causes pain and swelling in the scrotum. The pain may come on gradually or suddenly. It may be a dull ache or a sharp stabbing pain. The scrotum may also feel tender and warm to the touch. Other common symptoms of acute epididymitis include discharge from the penis, painful urination, blood in the urine or semen, fever and chills, and swollen lymph nodes in the groin. If you experience any of these symptoms, it is important to see a doctor right away. Section 4. Diagnosing acute epididymitis. Diagnosing acute epididymitis usually involves a physical exam and a review of your medical history. Your doctor will examine your scrotum for tenderness, swelling, and warmth. They may also check your lymph nodes in the groin. To confirm the diagnosis, your doctor may order some tests, such as urine test. This test can help identify the presence of bacteria in your urine. Ultrasound. This imaging test can help visualize the epididymis and testicle to look for signs of inflammation or other abnormalities. Rectal exam. This exam involves inserting a gloved finger into the rectum to check the prostate for tenderness or enlargement. These tests help your doctor determine the cause of your symptoms and rule out other conditions. Section 5. Treatment options and recovery. The treatment for acute epididymitis depends on the underlying cause. If a bacterial infection is the cause, your doctor will prescribe antibiotics. It is important to take the full course of antibiotics as prescribed, even if your symptoms improve before you finish the medication. In addition to antibiotics, your doctor may recommend other measures to relieve your symptoms, such as pain relievers. Over-the-counter pain relievers, such as ibuprofen or acetaminophen, can help reduce pain and inflammation. Rest. Getting plenty of rest can help your body fight off the infection. Scrotal support. Wearing supportive underwear or using a scrotal support can help relieve pain and swelling. Cold compresses. Applying cold compresses to the scrotum for 15 to 20 minutes at a time can also help reduce inflammation. Most cases of acute epididymitis resolve within a few weeks with appropriate treatment. Section 6. Prevention and long-term health. There are several things you can do to help prevent acute epididymitis, including practicing safe sex. Use condoms consistently and correctly during sexual activity to reduce your risk of STIs. Getting tested for STIs. If you are sexually active, get tested for STIs regularly, especially if you have multiple partners. Maintaining good hygiene. Wipe from front to back after a bowel movement to prevent bacteria from spreading from the anus to the urethra. Staying hydrated. Drinking plenty of fluids can help flush bacteria out of the urinary tract. By following these tips, you can reduce your risk of developing acute epididymitis and maintain good reproductive health. UMCC, your ultimate medical consultant connector.